If you want to get involved, gemmapeacock.org is the website, Gemma with a J, hashtag 100,000 voices if you're on social media. Dr Ramesh Balusu, one of the country's leading specialists in this type of cancer. Dr Ramesh, good morning to you.
Hi, good morning. How are you?
I'm very well this morning, thank you. We have Sam, who is suffering from this particular form of cancer, and his wife Michelle with me in the studio as well.
I heard the story. I was actually on the way to Heathrow, so I did hear the story.
Excellent. Thank you very much indeed for listening and for joining us as well to give us your expert opinion on this. I mean, how rare is this GIST?
I mean, GIST as a whole are very rare cancers. We see about 15 to 20 per million population. Among the GIST, we have a subtype of GIST called wild-type GIST, which is what Sam has got. They are much rarer. We are looking at about 1 maybe to 2 million population, so not more than 100 people per year in the whole UK.
So for a start, he's really rare.
This is the rarest of the rarest cancers.
Okay, it's gastrointestinal stromal tumours, GIST.
That's right. It's a rare type of sarcoma of the digestive tract.
And in terms of treatment, the drug that potentially could extend Sam's life, how do you feel about this as a medic, and your whole career is about preserving life? How do you feel about having to make a cold, hard financial decision on a treatment like this?
I mean, without going into the politics, my primary aim is to try and keep my patients well and keep them alive for as long as I can. With the rare cancers, we have a completely different set of rules. What has happened with this drug is that this drug called Regorafenib is actually quite a useful drug in this type of cancer compared to, say, the bowel cancer, which the CDF combined this drug with. It is not a very effective drug in bowel cancer, but in rare type of GIST, this wild-type GIST, it seems very useful, and we have had patients who have been responding very well to the treatment. So our disappointment was when this announcement came out about 6-8 weeks ago, is that they made a mistake in combining the wild-type GIST patients, or the GIST patients as a whole, with the bowel cancer patients, because these two are completely different types of cancers. And that's where we are trying to highlight the difficulty with rare cancers, where the drugs we have are very limited number, and also the patients we have are very rare. We can't do the big trials we can do in common cancers like breast cancer, bowel cancer. So whatever drugs we have only got one drug, and that's it. We don't have any drug after this. So more research is needed, and we are in UK, we are working very closely with the GIST Support UK, which is the patient support organisation. We have set up a national clinic in Cambridge, which runs 3 clinics a year, and we get specialists from all over the country to sit down and talk to the patients and give advice. So that's happening on a regular basis, and the next clinic is going live in April, in about 4 or 5 weeks' time, and the clinics are held in Cambridge once every 3 months. So people like Sam, we're happy to see them in the clinic. So the main thing is to get this drug back onto the CDF list. That's the most important thing, and we are actively encouraging everybody to sign up to the petition so that we can have a debate in the Parliament.
Dr Balusu, you've made Michelle cry. Why?
Just because it's just, so real what he's saying.
This miscategorising of the drug.
Yeah, that's it, yeah.
It's in the wrong category. And so if Sam was your patient, I mean, I don't know how much you know about Sam's prognosis, Dr Balusu, but do you think this drug could help him?
Regorafenib, we have been using it wild-type GIST patients for about 1.5 years now, and we have seen a fairly good, what we call as durable responses, much better than what we were expecting. The aim of the treatment actually is to try and keep Sam alive for the next drug. The next drug may not be far away, and there is a huge national and international effort to try and find the new drugs for these rare cancers. These rare cancers are very difficult to treat, and they have to be treated in specialist centers. And the important thing is, if the patient is actually responding to treatment, and if they have a drug which is likely to extend their lives, we want to try and keep them alive for as long as we can, so that they're ready for the next drug when the next drug comes along. And that's what the aim of the treatment should be, not about the cost, not about the who's funding it and where the money is going to come from. With the rare cancers, you have a completely different perspective.
Yes. Sam, what do you say to that, what the doctor's been saying?
Yeah, he's hit the nail on the head, hasn't he? Everything he's just said is, just... Again, overwhelming.
Where does the power lie here? Is it the Cancer Drugs Fund? Is it about them changing their mind, or is it about Parliament telling them to change their mind?
I think the Cancer Drug Fund is doing a difficult job. I think we have to acknowledge that. We have a finite amount of money and limited pot of money to fund various things in NHS. As specialists, as consultants, we acknowledge that we cannot use every single drug which is available to us. But my argument has always been that in rare cancers, we cannot have that kind of luxury where you can say we only fund drug A and B, not drug C, because there's no drug D. So this is the kind of argument we are trying to have with the... whereas with bowel cancer or breast cancer, there are about 10 or 15 different types of medications available. So if drug B fails, you got drug C fails, you got drug D. So you can actually go on using various interventions. But
in this case, drug C is the last option currently.
Currently the last option, and we want to make sure that every patient who has a metastatic cyst, meaning a cyst which is not operable, will get the benefit. Hopefully they should get some life extension from this, and also try and keep them alive for the next drug, because next drug may be just around the corner.
That would be something. Listen, Dr. Ramesh Balusu, I really appreciate your time. I know you're very busy, but what you've said here has had a real impact for Sam and Michelle in the studio.
Thank you so much.
I mean, we are very happy to work with Sam, and Sam has got details of our patient director as well, Jane Bressington, who has been working tirelessly for the last 4 or 5 years to try and raise the awareness for this wild-type GIST patients. And we have a website which Sam may already be aware of.
Is that the Pause GIST?
Pause GIST, yeah.
Yeah.
pausegistclinic.org.uk. So we need to work together. This is the most important thing. With the patients, the carers, the healthcare professionals, all of us need to work together for this rare cancer. Otherwise, we won't get anywhere success-wise.
Well, really appreciate your expert opinion. Thank you for spending some time with us today. Thank you.
Thank you so much.
Thank you. Bye-bye, Sam.
Bye.
Bye, Michelle. Bye.
Bye.
Thank you.
Dr. Ramesh Balusu, who is consultant clinical oncologist who specialises in that gastrointestinal stromal tumour, which is the wild type that Sam has. That was amazing to see you two and your reaction as he was speaking there, because, you know, obviously for you it's the most important thing right now. Yeah. But here's somebody whose whole life has been in this kind of work, kind of backing up what you've said, which comes from the heart from you, but it also comes from his head, doesn't it?
Yeah, which is amazing, you know, to hear a doctor's, you know, say exactly what we're saying and have been saying for ages. It just makes it all, you know, even more real, doesn't it?
Okay. Christine Dipple says on our Facebook page, I've signed the petition, good luck to you both. Jess says, we send billions abroad, it's not our problem, yet we can't afford to look after our own people. I'm ashamed to be associated with this country. Well, Jeff, maybe you can do a little bit to help these two with the petition that they've got online. Thank you again very much for coming in. I'll let you get about your day. I don't want you to miss the second half of your day's work. Sam.
Thank you very much.
Okay, listen, good luck you two. Keep us in touch with how it goes. It's BBC Sussex.